I've been here presenting a workshop this morning with my colleagues who are also clinical fellows on the National Medical Director's Clinical Fellow Scheme. That's Olivia Jagger, Emma Parish and Abigail Moore. And we've been talking about work that we've been doing during our fellowship year around declaration of interests, particularly doctors' declaration of interests. We've all been part of a working group which is co-led by the BMJ and the RCP that came out of a meeting that was held in October last year. It was discussing doctors' interaction with industry and really exploring the possibilities for positive collaboration, but also some of the potential for conflicts of interest that comes out of that interaction. And as part of that meeting, there was a decision to form a working group to further explore how doctors might think about those conflicts of interest that can arise, and particularly what doctors and professionals can do about declaring their interests. So today we were talking as a working group really about partly a little bit about that work and some of the recommendations that working group are going to make, but really actually trying to think from a more sort of ethical perspective about what doctors' interests are, when interests become conflicts, and also sort of whether we should declare our interests and what the advantages of declaring interests are and the disadvantages, and what some of the ethical sort of questions are around declaration of interests. I think one of the key things that we learned sort of this morning from some of the lectures, or one of the things that was discussed that informed our work, was around sort of nudge theory, and particularly thinking about conscious and unconscious bias and awareness of, I suppose, market forces as well, and how that relates to declaration of interest certainly is how relevant declaring your interests are if perhaps you're not aware of them, and how declaration of interest might not be as effective given that people have unconscious bias, and we talked about that in our workshop as well.